Mehta, Assistant Professor Medicine, SCB Medical College, Cuttack, Odisha. So what you should know about diabetes. So how the diabetes patient presents? So patient with diabetes commonly present with unusual thirst, frequent urination, tiredness, weight loss or general feeling of unwell. And symptoms develop very quickly, especially in type 1 diabetes within a very few days or weeks. However, people with type 2 diabetes develop symptoms rather slowly over the years. Many years may pass before the patient comes to the physician. So this means that this person people may already have complications when first diagnosed. So when the treatment for diabetes is started, the symptoms begin to resolve, but the symptoms may re-emerge if the blood glucose levels are poorly maintained. So these blood glucose levels have to be maintained. The periodic checkup and proper anti-diabetic drugs. And many people fail to notice the symptoms of diabetes, and the diabetes is picked up only during a routine medical checkup. So what are the tests we do for a diabetic patient? First is required, there are broadly 3 tests that are used to measure your blood glucose level: fasting plasma glucose test, random plasma glucose test, and HbA1c test or glycated hemoglobin test. In fasting glucose test, you will have to stop eating and drinking for at least 8 hours before this test. A blood sample will be drawn to measure the sugar level. Random plasma glucose test also measures the amount of sugar in your blood, but you don't have to stop eating or drinking before the test. That is can be done even if you have food. An HbA1c or glycated hemoglobin test provides your average blood glucose level over the past 2 to 3 months. It measures the percentage of blood sugar attached to the hemoglobin, the oxygen carrying protein in the blood cells, and you don't need to fast before this test. And in case type 1 diabetes is suspected, the physician will test your urine for the presence of the byproduct produced when muscle and fat tissue are used for energy, is the ketones. This happens because the body doesn't have enough insulin to use the available glucose. The doctor will also likely to run a test to see if you have a destructive immune system associated with type 1 diabetes called the autoantibodies.